What's up, Primal fam? Welcome back to another 5-minute mobility session with me. Today, we're gonna be addressing knee pain. Now, when it comes to knee pain, there's a few things that we need to address. One, resilience. How much stress can your knee take on in your movements in the gym? Two, ankle mobility. We need to make sure that the relationship between the tibia and the knee is well taken care of down at the ankle. And three, hip mobility. The same way we need to focus on the tibia and how that's moving within the knee, we also need to make sure that we're focusing on how the femur is moving at the knee as well, which often comes from a lack of hip mobility. So we're gonna be focusing on all three of these things within this 5-minute mobility session. So I have my timer here. We're gonna be getting started, and all we're gonna need for this routine is something to elevate your front foot on. I have a bumper plate here. If you do not have that, that's fine, you can do without, but it's gonna be a lot easier if we're able to elevate that front foot. So if you're ready, I'm gonna hit the timer here and we'll get started right away with some ankle cars. So starting off in this position, I want you to hug your knee up to your chest as much as you can. If not, do it out in front of you. And we're going to take our ankle through the biggest range of motion that we possibly can, nice and slow, and avoid moving the knee at all. We just want that ankle to be moving. Do one big circle and then reverse it completely. Nice and slow. I want the muscles at the front of the shin to be firing up like crazy. That is one rep. We're gonna do one more, 2 per side here. You wanna be contracting the calves as much as you can. You may almost feel like your foot is gonna cramp, but you're moving nice and slow, trying to move in a way that's going to build stability and control through those deepest ranges of motion. That's 2 reps per side. So immediately we get into the other side. This side clearly feels a little weaker to me. Stay very focused on the ankle. Don't get distracted around you. Focus on how the ankle is moving. We're already a minute 15 in. That's 1 rep. I may even be going for 2 here, or 3. Nice and slow, build that stability and control. Boom. Next, we're gonna get into hip capsule cars. You're gonna lay flat on your back, pull one knee up to a 90-degree angle. From here, you're going to rotate it out to the side as much as you can for a strong contraction in the hip and count to 2, and then reverse in the opposite direction. 2, and again, one more rep on each side. 1, 2. I want a strong contraction. Pull hard for that rotation. 2. I'm gonna turn this way so you can see what I'm doing. External rotation here. Hold for 2 and reverse it. 1, 2, and again on the other side. 1, 2, 1, 2. Those should fire up the hips a lot. Next, we're gonna get into pigeon holds. So from here, getting into a classic pigeon position, I'm going to elevate my hips and I'm going to hold that for the count of 20 seconds. Now I'm gonna turn so I can see my timer here. Elevating the hip as much as you can. We wanna try and avoid leaning too far forward. Try and elevate that hip and keep a nice tall posture. Really build stability in that glute and that hip. Hold yourself if you feel like you need to. We got 5 seconds. 4, 3, 2, 1, and switch sides. Elevate that hip. Really focus on building stability. You want to feel that glute firing up, so press your knee down into the floor. And again, hold yourself up if you feel like you need some support. And for that back hip, really engage the glute. Try to work on that hip extension. 2 seconds left. 1, 2, and rest. Now we're going to use that elevated front foot. We're going to use the bumper plate. From here, we're going to get into some KOT split squats, some knee over toe split squats, or ATG split squats. And get that knee as far over your toe as you can. And come back. We're doing 5 per side. The nice little pause at the bottom. Here we're building resiliency in that knee. Letting that knee get over the toe and build strength and stability in that deep end range position, and just allowing the stress to build up in the knee and ultimately become more resilient to it. One more here. If this is too painful, just reduce your range of motion. Good. Go to the other side and go again for another 5. As I said, if it's too painful, just reduce your range of motion slightly. You can stop early. Go as deep as you can though. Nice little pause at the bottom. 3, 2 more. Nice deep stretch through the back hip as well. Elevating that front foot really helps not feel like you're being limited by that back hip if you're struggling with that mobility. Boom. Excellent. And to finish off, we have 10 seconds of horse hold. So nice deep squat position here. Keep a nice tall posture. Open up. Squeeze the glutes. And that's that. Excellent. Just over 5 minutes there, but we made it happen. Now, I know that time is often the biggest limitation for a lot of you. It's challenging to find the time to put the work in on your mobility, but if you can find 5 minutes and put the work in on a routine like this, your joints will feel so much better. Now, I want to be very clear that it's important that you apply the right intensity. Show up and put the work in. Don't lazily go through this. Really drive and bring in the energy. Now, if you found this video valuable and you want to continue taking your mobility training seriously, check out this other video that YouTube suggests that you watch. I don't know if it's going to be over here or over here. Check it out. As always, if you have any questions or concerns about your mobility, drop them in the comments below and I'll hop in there and make sure that I point you in the right direction. Thanks for hanging out, and I'll catch you on the next one.